Center Test Prep Exam Course. Question 1. A patient presents with a painful, red eye, cloudy cornea, fixed mid-dilated pupil, and increased intraocular pressure. The nurse suspects option of open-angle glaucoma, option B acute angle closure glaucoma, option C conjunctivitis, option D uveitis. The correct answer is option B, acute angle closure glaucoma. The presentation is classic for acute angle closure glaucoma, an ophthalmologic emergency. The sudden rise in intraocular pressure causes eye pain, cloudy, steamy cornea, a fixed mid-dilated pupil, and requires immediate treatment. Question 2. A patient with a Le Fort 3 fracture is at highest risk for option A, dental malocclusion, option B, airway compromise, option C, corneal abrasion, option D, temporomandibular joint dysfunction. The correct answer is option B, airway compromise. A Le Fort 3 fracture, craniofacial disjunction, can cause posterior displacement of the maxilla and soft palate, which can obstruct the airway, making airway assessment the highest priority. Question 3. A patient with a history of renal calculi presents with severe flank pain, nausea, and hematuria. The priority intervention is option A, forcing oral fluids, option B, straining all urine, option C, pain management, option D, surgical consultation. The correct answer is option C, pain management. While all are appropriate interventions, severe pain from renal colic is excruciating and requires prompt, aggressive pain management as the initial priority. Question 4. A patient leaving against medical advice, AMA, must be informed of option A, they cannot ever return to this hospital, option B, their bill will be sent to collections, option C, the risks and potential consequences of leaving, option D, the police will be called. The correct answer is option C, the risks and potential consequences of leaving. A patient who has decision-making capacity has the right to refuse treatment and leave AMA. The nurse's duty is to inform the patient of the risks, alternatives, and potential consequences of their decision, and to document this thoroughly. Question 5. The hallmark sign of compartment syndrome is option A, pain relieved by elevation, option B, pain out of proportion to the injury, option C, absent pulse in the affected extremity, option D, pitting edema. The correct answer is option B, pain out of proportion to the injury. Pain that is severe, unrelenting, and disproportionate to the physical exam findings is the classic early sign of compartment syndrome. Pain with passive stretch of the muscle is also characteristic. Pulselessness is a late and ominous finding. Question 6. A patient presents to the emergency department with a laceration that requires sutures. During the procedure, the patient states they feel faint. The nurse's first action is to option A, administer oxygen, option B, place the patient in Trendelenburg position, option C, immediately discontinue the procedure, option D, assess vital signs. The correct answer is option C, immediately discontinue the procedure. The nurse should instruct the provider to immediately stop the procedure to reduce vagal stimulation and prevent syncope. After the procedure is stopped, the patient can be placed supine and assessed. Question 7. The emergency nurse is caring for a patient with suspected pericardial tamponade. Which triad of findings, Beck's triad, is most consistent with this diagnosis? Option A, fever, chest pain, friction rub, option B, hypotension, muffled heart sounds, distended neck veins, option C, hypertension, bounding pulses, headache, option D, dyspnea, crackles, pink frothy sputum. The correct answer is option B, hypotension, muffled heart sounds, distended neck veins. Beck's triad consists of hypotension, from decreased cardiac output, muffled heart sounds, from fluid in the pericardial sac, and jugular venous distension, from impaired venous return. Question 8. A nurse witnesses a colleague diverting narcotics. What is the appropriate initial action? Option A, confront the colleague directly. Option B, report the observation to the charge nurse or manager immediately. Option C, document the observation in the patient's chart. Option D, call the police. The correct answer is option B, report the observation to the charge nurse or manager immediately. The nurse has an ethical and legal duty to report suspected impairment or diversion to the appropriate supervisor immediately. Confrontation can escalate the situation and compromise the investigation. Question 9. Under the Emergency Medical Treatment and Active Labor Act, EMTALA, a medical screening exam must be provided to Option A, patients with private insurance only. Option B, any person who comes to the ED and requests care. Option C, US citizens only. Option D, patients with urgent conditions only. The correct answer is option B, any person who comes to the ED and requests care. EMTALA mandates that any individual presenting to a Medicare participating hospital with an emergency department must receive a medical screening examination, regardless of ability to pay, insurance status, or citizenship. Question 10. Sudden, painless loss of vision described as a curtain coming down over the eye is a classic presentation of Option A, acute glaucoma. Option B, retinal detachment. Option C, corneal abrasion. Option D, cataract. The correct answer is option B, retinal detachment. The patient's description of a curtain being pulled down or a shade being drawn over their vision is the hallmark symptom of retinal detachment. Question 11. When receiving a verbal or telephone order in an emergency, the nurse should Option A, carry out the order immediately without verification. Option B, write it down and read it back to the provider for verification. Option C, ask another nurse to take the order. Option D, refuse to take verbal orders. The correct answer is option B, write it down and read it back to the provider for verification. The best practice for verbal or telephone orders is the write down. Question 12. Testicular torsion is a surgical emergency that requires intervention within Option A, 24 hours. Option B, 4 to 6 hours. Option C, 2 to 3 days. Option D, it is not a surgical emergency. The correct answer is option B, 4 to 6 hours. Testicular salvage rates are highest when detorsion occurs within 4 to 6 hours of symptom onset. Delay leads to testicular necrosis and loss. Question 13. A patient in the emergency department suddenly develops pulseless ventricular tachycardia. The monitor shows a wide complex tachycardia at 220 bpm. What is the priority intervention? Option A, administer amiodarone 300 mg for push. Option B, synchronized cardioversion at 100 J. Option C, immediate high-quality CPR and defibrillation. Option D, transcutaneous pacing. The correct answer is option C, immediate high-quality CPR and defibrillation. Pulseless ventricular tachycardia is a shockable rhythm treated with immediate defibrillation, not synchronized cardioversion. CPR should be initiated and defibrillation performed as soon as possible. Question 14. The antidote for benzodiazepine overdose is Option F, naloxone. Option B, flumazenil. Option C, denacetylcysteine. Option D, datropin. The correct answer is option B, flumazenil. Flumazenil is a competitive benzodiazepine receptor antagonist. However, its use must be approached with caution, especially with unknown ingestions or chronic users, due to risk of seizures. Question 15. A patient presents with a chemical eye splash. What is the priority nursing intervention? Option F, patch both eyes. Option B, immediate copious irrigation with water or normal saline. Option C, administer topical antibiotic drops. Option D, perform a visual acuity test. The correct answer is option B, immediate copious irrigation with water or normal saline. Immediate and prolonged irrigation of the affected eye to dilute and remove the chemical is the single most critical intervention to prevent permanent corneal damage. Irrigation should precede any other assessment. Question 16. A patient sustains a laceration and has not had a tetanus vaccine in 12 years. The wound is clean and minor. The nurse should anticipate. Option A, no tetanus prophylaxis needed. Option B, tetanus immunoglobulin only. Option C, TDAP or TD booster. Option D, tetanus toxoid and tetanus immunoglobulin. The correct answer is option C, TDAP or TD booster. For a clean, minor wound and a vaccination history of more than 10 years since the last dose, a TDAP or TD booster is indicated. Tetanus immunoglobulin is for patients with unknown or incomplete vaccination history and contaminated wounds. Question 17. The most critical treatment for a patient with heat stroke is option A, boral rehydration with electrolyte solution. Option B, rapid cooling to a core temperature below 39 degrees Celsius, 102 degrees Fahrenheit. Option C, administration of antipyretics. Option D, active external rewarming. The correct answer is option B, rapid cooling to a core temperature below 39 degrees Celsius, 102 degrees Fahrenheit. Heat stroke is a life-threatening emergency defined by hypothermia, usually 40 degrees C/104 degree F, with CNS dysfunction. Immediate, aggressive cooling is the definitive treatment. Antipyretics are not effective. Question 18. A patient presents with cramping abdominal pain, distension, vomiting, and high-pitched tinkling bowel sounds. These findings are most consistent with option A, gastroenteritis, option B, bowel obstruction, option C, irritable bowel syndrome, option D, acute pancreatitis. The correct answer is option B, bowel obstruction. The classic presentation of a small bowel obstruction includes cramping pain, abdominal distension, nausea/vomiting, and early high-pitched, hyperactive bowel sounds, borborygmi, that become absent later. Question 19. A patient with acute pancreatitis should have which nursing intervention as a priority? Option A, encourage early ambulation. Option B, keep the patient NPO and provide aggressive for fluid resuscitation. Option C, administer high-fat diet. Option D, restrict all for fluids. The correct answer is option B, keep the patient NPO and provide aggressive for fluid resuscitation. Initial management of acute pancreatitis includes bowel rest, NPO, to reduce pancreatic stimulation and aggressive for fluid resuscitation to prevent hypovolemia and maintain pancreatic perfusion. Question 20. A Cole's fracture involves the option A, proximal humerus, option B, distal radius, option C, femoral neck, option D, tibial plateau. The correct answer is option B, distal radius. A Cole's fracture is a fracture of the distal radius with dorsal angulation, usually from a fall onto an outstretched hand, foosh. Question 21. Carbon monoxide poisoning leads to hypoxia primarily by option A, causing bronchospasm, option B, binding to hemoglobin with higher affinity than oxygen, option C, destroying lung parenchyma, option D, causing pulmonary edema. The correct answer is option B, binding to hemoglobin with higher affinity than oxygen. Carbon monoxide has an affinity for hemoglobin 200 to 250 times greater than oxygen. By binding to hemoglobin, it forms carboxyhemoglobin, reducing the blood's oxygen carrying capacity. Question 22. Hepatitis is primarily transmitted via option A, blood and body fluids, option B, fecal-oral route, option C, sexual contact, option D, contaminated needles. The correct answer is option B, fecal-oral route. Hepatitis is transmitted primarily through the fecal-oral route, often through contaminated food or water. Hepatitis B, C, and D are bloodborne. Question 23. The most effective method to control severe bleeding from an extremity wound is option A, elevation, option B, direct pressure, option C, pressure point compression, option D, ice application. The correct answer is option B, direct pressure. Direct, firm pressure applied to the wound is the most effective initial method for controlling severe external hemorrhage. Tourniquets may be used if direct pressure fails. Question 24. The clinical finding that differentiates a massive hemothorax from a simple pneumothorax is option A, absent breath sounds, option B, dullness to percussion on the affected side, option C, trickle deviation, option D, subcutaneous emphysema. The correct answer is option B, dullness to percussion on the affected side. With hemothorax, blood in the pleural space. Percussion produces dullness due to fluid. In pneumothorax produces hyperresonance due to air. Both cause decreased breath sounds. Question 25. Which finding on end-tidal CO2, ETCO2, monitoring indicates successful endotracheal intubation? Option A, ETCO2 of 0 mm Hg. Option B, persistent ETCO2 waveform with each ventilation. Option C, ETCO2 of 50 mm Hg. Option D, a flat line waveform. The correct answer is option B, persistent ETCO2 waveform with each ventilation. Waveform capnography is the gold standard for confirming ET tube placement. A persistent, characteristic waveform of exhaled CO2 confirms the tube is in the trachea. Zero or flatline reading suggests esophageal intubation.